another great week for COVID. The number of cases are down. The number of positive situations are down. And we are, 60 plus days into the semester, halfway, I believe, in class days. And, a month since university employees returned to campus. We've not had any spikes, no issues. We're just kind of trucking along. This is awesome news because it makes our outlook for the summer and the fall even better. First of all, I want to commend Governor Ivey on her decision and her wisdom to extend the mask mandate basically beyond Easter. That was a very wise decision. The virus has not gone anywhere. We are enjoying more personal freedoms, etc., because of the lower transmission of virus. Deaths are still up. So how will it affect Auburn? We really need to continue our mask mandate for now, but we are definitely looking at changing parts of it going forward. The science, the change in the temperature, and the timing is all going to affect those decisions. So again, look ahead, and we will have more to say about this in the future. With a large organization like the university, and as the world and the United States is getting back to some degree of normalcy, there's definitely more meetings and more face-to-face opportunities coming up. As such, both domestic travel and other travel will start opening up even more. And the big decision now is the travel a need or is the travel a want? So again, taking all that into account, Auburn's senior leadership team rightfully made the decision for us to start putting the travel down at a supervisor level, who is better able to talk individually with faculty or staff regarding the need versus the want for travel and how it can impact their program, their department, their research, all the different things that could be impacted. It's going to be taken down to that level, which is, I think, a great thing at this point in the pandemic. We're fortunate we did not have a flu season, but that didn't affect the trees and the plants. So we are having a pollen allergy season. That's just started. Of course, the symptoms consistent with allergies are also symptoms that could mimic COVID. So I think people need to consider that when you start developing nasal congestion, cough, all of those things, the difference between COVID versus allergies. And if you need to, you should seek medical care. If you need to, you should consider being tested. If you know you had situations that more than likely you could have been exposed to COVID, don't just always assume it's allergies. Another great thing I will tell you, wearing masks decreases the amount of pollen and exposure you get, which also decreases allergy season symptoms. So the mask still continues to help in other ways other than just preventing the transmission or getting infected with COVID. Testing, absolutely. Again, the virus hasn't gone anywhere. Yes, the number of cases are down, but it's still, we haven't gone any days yet with no positive cases. So you still need to consider getting tested when you start developing symptoms that are consistent with COVID. By now, everyone should know what that is. The testing centers are open. Many of them are very available. At the clinic, we've got all versions of the test: PCR, rapid antigen, rapid molecular, rapid antibody. Everything's available. So yes, testing needs to continue, including sentinel testing. If you get invited for sentinel testing, please do it. It's important because now that we're opening things back up more, and as we continue to expand opportunities, we need to make sure that any possible early outbreaks, we catch it early and mitigate it so we don't have to take aggressive measures. So at this point in time, we have administered over 10,000 doses of the vaccine. This coming week, some people will get invitations to get their first dose because for those who wanted their second dose, and if their second dose predated March 5th, everyone that predated March 5th for a second dose should have gotten an invitation and an opportunity to get their second dose. If you didn't, you need to contact A Healthier You. Now, if you had told A Healthier You in advance that you had a circumstance why you could not get your second dose, such as you got COVID, or such that you were administered a medication that postponed your second dose. If you've already done that, great. You don't need to do it again. If you haven't, then you want to email A Healthier You, the resource center, and let them know. If you don't think you got an invitation for your second dose, you should go check your spam box, your inbox. We can only send emails to invite you. We don't read the email for you. So you need to go ahead and look at that. And if that's the case, then same thing, contact the A Healthier You, let them know. But at this point in time, everyone eligible for a second dose before March 5th got an invitation. So we're switching back to giving first doses with the remainder of the vaccine that we have available, and that will happen this week.